Doc on the Run. We help injured runners run.
When it comes to healing and trying to figure out that line between too much activity and not enough activity, pain really is your guide. And normally doctors tell patients that they should, evaluate their pain and rate it on a scale of 1 to 10. So a pain level of 1 is minimal discomfort, almost unnoticeable. A pain level of 10 would be excruciating. Think of somebody chopping off your leg with a dull axe. Now, interestingly, in the last 15 years or so, I don't think I have seen a single runner with any injury who actually said they had a 10 out of 10 pain level. I even saw a woman one time who fell in her apartment. She broke her tibia in half, and when I saw her, she was laying on the floor, and she only called it an 8 out of 10 pain. So the reason you and most runners don't seem to note a high level of pain when injured is that you, as a runner, have learned how to tune out pain and ignore it. You try to ignore pain when you do hill repeats. You ignore pain when you run stairs. And you tune out pain and try to focus when you do speed work. And of course, you shut out the painful noise in your leg when you're finishing a marathon. Now, through the magic of neuroplasticity, you have basically habituated yourself to downcode your pain. But you still have to try to look for it. You have to identify it, and you have to rate your pain consistently and accurately if you want to stay active and keep healing. You have to know where the line is. You have to be able to recognize the pain. You have to know that pain level, and you have to know what that pain level is that could actually be causing damage. So an increase in pain obviously signifies more stress and probably more tissue damage to the healing injury. But a decrease in tenderness signifies healing and increased stability that can justify a slight increase in your activity level. But you have to look for the small changes in your pain level to make that call. So that's the thing is, you have to think about this, right? As a runner who has learned to ignore high levels of pain, his job can be really difficult, but it's absolutely necessary if you really want to advance your fitness ahead of schedule. So your job in looking for pain and soreness is to put a number on it. Now, it doesn't really matter what the number is, but you have to be able to rate it consistently. So let's say if you think your pain is a 3 out of 10, but then the next day you notice you actually have swelling in your foot, well, you did way, way, way too much activity, and you were causing enough tissue damage to get rebound inflammation and swelling. So my guess is that a normal patient probably would have called that 3 out of 10 level of discomfort something more like a 7, 8, or 9 out of 10 pain. Now, over and over, runners tell me that they don't really have pain, but they only have some kind of discomfort. Well, you can call it whatever you want, but you have to be able to assign a level of pain or a level of discomfort that you can actually track.
Doc on the Run. We help injured runners run.